Okay, so I put the date, I put my initials, I'm the one who did the dressing change. I peel it off and I place it down right here. You just want it on the same part as the material outlining is. You don't want to put it like over the site. And then, so if you can see here, everything is in the dressing, but in this area here, it's a little bit very close to the edge. So I'm going to grab a steri strip that is in the dressing change kit. So these are the steri strips that were inside the dressing change kit. All I'm going to do is pull this little thingy off here. Pull one off. And place here.
Done?
Almost done. So now you see the outlining part of the dressings fully covering all of the line. The thicker part is inside the dressing and you have a portion hanging out, which is fine. But you want to have as much as possible, you want to have this thicker part in the dressing as much as possible. This is okay. So now her dressing is all sealed. I'm going to go ahead and take my gloves off.
Done?
Not yet, Ani, we got to do your stickers. Now we're going to use our Tegaderms. And this is just reinforcement and protection. So, like when Ani brushes her teeth, she spits, and then if she didn't have these Tegaderms, don't do it, Ani, then the dressing material would be soiled, and then we would be doing lots of dressing changes every week instead of 1 to 2. And you know, this is, you know, very important to keep the procedure the same. And in doing that, it keeps her line protected from infection. And it's so important is line protection from infection. Well, how do you like that little rhyme, guys? A rapper. Just kidding. So we got this much. We're going to do the upper portion. I want to keep looking at your movie. Sometimes you got to push the skin away to make it taut. And then over here. And throughout the week, if you know some edges get lifted, you can always reinforce with Tegaderm. But you don't want to be reinforcing to the point where like it's like air all in the dressing. So, I mean, just use your common sense, basically. Okay, I'll just open your arm up.
We're done?
Let me see. Hold on.
We're done?
Hold on, let me show them. So if you can see, the Tegaderm is all around the edges. There's one little area right here, but I'm not concerned too much about that. Just because in this armpit area, she tends to sweat. And sometimes if the Tegaderm there, it lifts faster than the dressing. So this little area here, it's okay. The real big concern is all this, and this. you know. But again, too, if this is really lifting, you definitely want to reinforce it. So this is the complete dressing change. All you got to do after this is clean up your mess, and don't throw away your scissors, but you could discard everything else, and then you're done.